Hi, Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. Today we will be discussing an example case of a young person. There are many such instances where people who have extensive history of hair loss or history of extensive hair loss in their family approaching us when they are still young, maybe in their 20s, with hair loss in their hairline or frontal areas. Now, if the patient has enough donor in his scalp and beard and body areas, then it is not necessary that we refuse the patient because this is the age when he actually needs the hair in this area, both for different aspects of his life. So a strong hairline framing the face is essential at this time. So this picture shows him when he is quite young in his 20s and he has lost a lot of hair in his hairline. In fact, he has no hairline to speak of, but his vertex hair are still quite strong. We drew this hairline for him, neither very aggressive nor very conservative. And let's see. Now, 5 years after his initial procedure, he has a good strong hairline and that has served his purpose, covering the receding hair in his vertex areas and making a strong frontal look. Now let's see over the years his hair, as you can see, have been lost, miniaturized in the vertex area going towards the crown. In his initial session, we had also placed grafts in his crown area. If you see in the picture, there is a wall of hair on that side also. So this in-between area of the vertex and some part of the frontal is what is empty for his second procedure. He also noticed some hair loss in the sides where we had transplanted the earlier hairline on the side of that hairline. So this time we will be transplanting grafts from his scalp as well as beard area into those empty spots. Now this case discussion has important lessons for patients. One is that yes, if you are young, don't think that you will never need another hair transplant. We can give you a very natural, dense hairline, dense young look also, but your genes will work out their lifespan. So they will induce hair fall at some age. So when that hair fall occurs, you should be ready to catch up with that hair fall and go for more transplants. Of course, there will be two questions. One, will I have enough donor? For that, if you have history of extensive hair loss in your family, then scalp hair will not be sufficient. You must be ready to use beard hair also, or rather you must have some beard hair to donate or transplant. Now this patient has a good quantity of beard hair. Now let's see his beard area. The second question which patients ask is visible scarring in the beard donor area. Now this is the beard donor area 5 years after the extraction. So you can see that there is no visible scarring, and this has encouraged him to go for his second procedure, in which again we will be using grafts from the head area as well as the beard donor area. So while using the fuse or FUE technique, we have been taking out grafts from the beard area since 2006, which was in fact the first known case in which beard hair to scalp transplant was done in the world by us in using the FUE technique. Now this really opens up the number of grafts available, increases, doubles or even triples the number of grafts available so that we can help patients while they are young and losing hair, as well as later on when their hair loss progressive. All that I require from the patients is a good thorough assessment of the donor before they go for their first procedure, and a willingness to commit. Yes, if they lose more hair in future, then yes, they will be ready to go for more transplants. So I hope I cleared a lot of questions for the young patients especially. Thank you. If you have any questions, you can WhatsApp me or email me. Bye bye.